welcome to the 2020 UIC Department of Occupational Therapy Virtual Graduation Celebration. My name is Dr. Elizabeth Peterson, and I'm the Director of Professional Education for the Master of Science program. To say that 2020 has been a challenging and unusual year is an understatement, but it has also been a year of many firsts for us, and this event is no exception. In addition to this being our first ever virtual graduation ceremony, this is also the first time that we will be honoring OTD students as part of our celebration. Thanks to the PostProfessional OTD students for giving us even more to celebrate this year. Please join me in providing a warm welcome to Yolanda Suarez-Balcazar, Professor and Head, UIC Department of Occupational Therapy.
Dear class of 2020, despite going through a pandemic and racial justice unrest, events unlike any other year, all of you rose to the moment. This has been an unprecedented year for all of us, and we are so proud of you. You kept up with us as we learn how to navigate the virtual world, help us maximize the use of technology in our new virtual classroom, challenge us to address issues of racial justice, and importantly, you kept your spirits high through it all. These last few months have taught us that there is no challenge we cannot overcome. Thank you, class of 2020, for the many lessons learned. This special pinning ceremony to honor you is just the beginning. Continue to pursue great things. As Nelson Mandela once said, there is no passion to be found playing small, in settling for a life that is less than the one you're capable of living. The journey ahead is not an easy one. The challenging times call for health professionals to embrace harmony, compassion, sensitiveness, tolerance, and social and racial justice. We know that you are well equipped with these values and commitment to contribute to a better world. We trust that you will use your skills and knowledge as an occupational therapist to become agents of transformation and inspiration to others, that every challenge you face will become an opportunity to grow and learn just like you did in 2020, a year we will never forget. Successfully completing a graduate degree requires a community support and the contributions of many individuals. First of all, your classmates who have been with you throughout this journey every single day for the last 2.5 years. I would like to acknowledge our academic faculty and adjunct instructors for the commitment to our students and the profession. We are very proud of our faculty, all of whom are recognized as national and international leaders in occupational therapy scholarship, education, and practice. Our faculty worked very hard to successfully transition to online education and supported you throughout the pandemic. I would also like to recognize the support of the academic professional staff. Our staff's energy and valuable support play a critical role in your education. Other individuals who have been instrumental in your education at UIC included the clinical staff from UI Health, the many clinical fieldwork educators who supervise your experience, and our community partners who provided many real-world learning opportunities. I must also acknowledge the support of your loved ones, family, and friends. Their unconditional love and support throughout this journey has made it possible for you to become an occupational therapist. Graduates, whether you decide to go into clinical practice, pursue leadership opportunities, or continue into the occupational therapy doctor or PhD degree, I wish you well. I know that you will be successful. Please come back, visit, become an active alumna, and we look forward to seeing you face to face again sometime soon. To close, I would like to leave you with a quote from Ralph Waldo Emerson. Do not follow where the path may lead. Go instead where there is no path and leave a trail. On behalf of the Occupational Therapy faculty and staff, congratulations, class of 2020.
Thank you, Yolanda. Each year we have the honor of presenting several awards to students and faculty to recognize special achievements. However, first, it is important to emphasize that the accomplishments of all of our graduates, individually and as a group, are quite impressive. We are so proud of this year's graduating class. Graduates, you have earned your master's degree and soon will be licensed and certified as an occupational therapist if you have not yet already earned that credential. Even as students, you have developed solutions to real-world problems for occupational therapy service recipients, for occupational therapists, local community agencies, and your fieldwork sites by applying your knowledge and skills in highly contextualized ways. Your accomplishments are so impressive. Consider that some of you have already contributed to the science and mission of the department and the university as student workers. Some graduates have produced scholarly publications in important journals such as the American Journal of Occupational Therapy. Members of this class participated in the 2019 Annual Occupational Therapy Association Conference in New Orleans and the virtual AOTA Conference in 2020, as well as our State Association Conference. 3 students participated in Hill Day in Washington, D.C., and 13 members of this class were fellows of the Health and Diversity Academy. The fact that you have so effectively completed your OT education during an unprecedented time in our nation's history is truly inspiring. In March of 2020, your Level 2 fieldwork was dramatically disrupted due to the COVID-19 pandemic. 9 months later, we all continue to face an international public health crisis that has changed nearly every aspect of how we interact with one another. We have also faced a divisive presidential election and a national reckoning with systemic racism. Through it all, you have been resilient and creative in your ability to support each other. While it is disappointing that we're not able to celebrate your momentous accomplishments in person, it is fitting that the audience for your graduation is broader than ever before. The tight-knit community that is celebrating today extends across state lines. Together, we continue to be there for each other and to create tomorrow's practice. While our challenges have never been greater, our newfound ability to use resources and solutions to build our connectivity that serves us all will really serve us in the future, both professionally and personally, certainly in the years ahead. And there's good reason to keep in touch. As members of the class of 2020, you share a unique bond, and what a wonderful group of people you are. The faculty describes you, the graduating class of 2020, as not only resilient, but also friendly, funny, caring, creative, particularly interested in learning about the global applications of occupational therapy, and committed to social justice. When asked to describe you as a class, the faculty highlighted how you advocated for others and yourselves. You were not afraid to speak up about changes and needs, and you did so in a professional way. You advocated for what was needed with an understanding of the multiple factors that influenced decisions. The faculty also recognize that you are a class that's willing to take risks and you are comfortable with the uncomfortable. You ask excellent questions and have been a particularly engaged group. The faculty is deeply appreciative of your willingness to share your unique insights about diversity and environmental factors. You have pushed us as educators by your desire to learn as much as you could and to delve deeply into content. When faculty were trying new learning activities, and there were many, you were willing to go there with us, give it a try, and provide us feedback to make it better for the future. As a class, you've been extremely conscientious. You've always been respectful to guest lecturers, consumers, families, and the faculty. Even small things like helping to set up the classroom or carrying lab materials showed how much you supported the faculty. You've been so supportive of one another and very cohesive as a class. You've been a delight to teach, and you've made a lasting impact on the faculty. Thank you for your strong legacy of advocacy, respect, and professionalism that you are leaving behind. We will certainly miss you. You should all feel very proud of what you have accomplished individually and as a class. And now at this time, I would like to invite Gail Fisher to present our first awards.
Hello, it's my pleasure to present 4 different awards as part of the pinning ceremony. Really, this year, I think everyone should get an award, don't you think? But we do have a few special awards that I'm going to present. Occupational therapy faculty nominate graduates for these first two awards, and then faculty vote to determine who receives each one. The Achievement Award is presented to one graduating student from each degree program in our college. This award recognizes a graduate who's excelled in academic achievement, leadership, and/or service. And this year we had 3 MS Achievement Award nominees. Danielle Rowe and Courtney Heidel were nominated for successfully creating and implementing a client-centered wellness program at Grace House, one of our community partners on the west side of Chicago, which provides housing for formerly incarcerated women who are transitioning to community living. Serena Saki was nominated for her achievements in teaching, research, and scholarship, which included being a co-author of a forthcoming article in the American Journal of Occupational Therapy about occupational therapy's role with COVID patients in acute care. Very timely. The recipient of this year's award is Serena Saki. Congratulations, Serena. The second award is the UIC Emerging Leader Award. It recognizes an MS student who's shown dedication and commitment through one or more of the following: volunteer service and leadership, presenting at a local organization or a professional conference, or co-authoring a publication, or establishing a program, organization, or event. This year we have 2 emerging leader nominees. Ina Karanja was nominated for her role in leading her classmates and advocating with our faculty and others at UIC for change and justice during the tumultuous spring and summer of 2020. Ina clearly has the potential to lead future initiatives. Estefania Garcia Gomez was nominated for her service to Chicago area Latinx families and individuals with developmental disabilities. In her experience on a research team, she took on a leadership role to create and implement presentations for community organizations on staying safe and active during the pandemic. And Estefania is the recipient of this year's Emerging Leader Award. Congratulations, Estefania. Even though I'm not able to present them in person, you will get certificates in the mail. Next, I have the pleasure of presenting 2 more awards on behalf of our academic fieldwork coordinators, Kathy Preisner and Piper Hansen. Both awards are named in honor of our department's founder, Beatrice D. Wade, who established our department in 1943. But before we announce these awards, Kathy and Piper wanted me to acknowledge the fieldwork accomplishments of the entire class. Fieldwork is a challenging component of the curriculum in any year, and this class rose to the challenge. Congratulations to you all for your hard work, perseverance, and success during fieldwork during this unusual year. The first Fieldwork Award is the Beatrice D. Wade Award for Clinical Excellence. Students are nominated for this award by their fieldwork educators for exceptional performance during fieldwork. This award includes a monetary award thanks to alumni donations and a certificate. The fieldwork coordinators and additional faculty select the recipients of this award. So this year we had 10 nominees: Megan Flaherty, Ruth Glass, Jillian Hazlitt, Ina Karanja, Julia Mycutt, Claire Mercer, Alexandra Newark, Jessica Pruka, Sina Webster, and Jennifer Yee. So congratulations to each of you. Your fieldwork educators clearly saw the potential in you and the future contributions you will make. This year's award goes to 2 graduates. The first is Megan Flaherty. Megan was nominated by Ashley Stoffel, Namrata Shah, and Veronica Urena at the UIC OT Faculty Practice for Children, Youth, and Families, where she provided clinical care and also contributed to our MS academic program. Meg's fieldwork educators noted her outstanding ability to plan interventions and evaluations, often with consideration of limited family resources and little or no previous telehealth experience. Congratulations, Megan. The second recipient is Ina Karanja. Ina was nominated by Janine Eastland at the Brooklyn Transition Center, part of the New York Department of Education. Her fieldwork educator said that Ina brought courage, vibrance, maturity, and selflessness to our community and to our OT practice. Ina's finest contribution was her positive attitude and empathy. When COVID hit near the end of Ina's fieldwork rotation, she identified ways to continue to address the students' goals using a teletherapy approach. Congratulations, Ina. Students, you are truly inspiring to us faculty. We're so proud of your accomplishments. The last award is the Beatrice D. Wade Award for Clinical Education. It's given to outstanding fieldwork educators who supervised our students. They're nominated by the graduating OT students, and recipients are chosen by a committee of students and faculty. First, I'd like to acknowledge this year's 19 nominees, which I think is a record, all of whom are exceptional fieldwork educators. Ray Sendejas and our own Ryan Tomier were nominated by 2 students from Alexian Brothers Bonaventure House. Roman Romosanta from Amita St. Mary and Elizabeth Medical Center, Sharon Seisinger, Central DuPage Hospital, Sarah Fry, Chicago Public Schools, Hannah Clark, HSC Pediatric Center, Janine Eastland, New York City Department of Education, Donna Smith and Caitlin Page, Niles Township District for Special Education. We had 3 nominees from Northwestern Memorial Hospital, Abby Eckhoff, Andrea Connolly, and Carrie Brower, who was nominated by 2 students. Andrea LaFleur, also nominated by 2 students at Revive Center for Housing and Healing. Elise Holzer from Rush University Medical Center, Lauren Mancuso, St. Anthony Hospital in Colorado, Eileen Brodecki, Shirley Ryan Ability Lab, and Ashley Stoffel, Namrata Shah, and Veronica Lorena at UIC's OT Faculty Practice for Children, Youth, and Families. Congratulations to all the nominated fieldwork educators, and we thank them all for their support of our UIC MS students. And 2 fieldwork educators are receiving the award this year. The first is Andrea LaFleur. Andrea was nominated by 2 students, Ruth Glass and Julia Mycutt, who noted that Andrea has created a flourishing fieldwork program at the Revive Center for Housing and Healing. She models being very intentional about creating client-centered and trauma-informed services and demonstrating her exemplary therapeutic use of self. She makes herself very available to students while providing them with autonomy to support their learning. Congratulations, Andrea. And the recipients of the second award are Ashley Stoffel, Namrata Shah, and Veronica Urena, who were nominated by Megan Flaherty. Megan said that by observing her 3 fieldwork educators, she learned what kind of OT she wants to become. The feedback helped her create more client-centered, evidence-based plans that included parent education and addressed multiple client goals. She considers herself fortunate to have had this opportunity to observe, learn from, and collaborate with 3 hardworking and passionate occupational therapists. Congratulations to all 3 of you. And thank you again to all of our fieldwork educators for supporting our students. My personal congratulations to all of our graduates and the awardees. And now I'd like to turn it over to Dr. Joy Hamill.
Hello, everyone. Next, I would like to present our PostProfessional OTD Achievement Award. But before I do this, I'd like to also recognize the many awards and honors our PostProfessional OTD students have received this past year, including many publications, presentations, scholarships, and fellowships. Congratulations. This year's OTD Achievement Award goes to Gina Malanthara. Her nominator described her as one of the best students I've ever had the fortune of advising as part of the PostProfessional OTD program. She has gone above and beyond to understand the depth of the Diabetes Center and the care that is offered to her patients. Her passion for people experiencing health disparities drives her quiet and consistent service. Congratulations, Dr. Malanthara.
I now have the privilege of presenting the 5-year and 10-year Teaching Service Awards. This year we have 20 5-year award recipients and 6 10-year award recipients. The 5-year Teaching Award recipients are Jason Brown, Susan Cahill, Raymond Candejas, Cheryl Chen, Missy Dappin, Kate Ciencio, Leah Dunleavy, Rachel Francis, Katie Frank, Elizabeth Harrison, Jim Hill, Gabriela Jacques Jimenez, Charles LaChance, Joseph Mendoza, Laura Mraz, John Munt, Elliot Roth, Nicole Suss, Lisa Vincent, and Kelsey Waters. The 10-year Teaching Service Award recipients are Mary Black, Caroline Deskin, Nancy Goodfellow, Karen Tamley, Lucy Trevina, and Tom Wilson. Our students, alumni, and faculty can attest to the fact that our adjunct faculty members are essential to our program. They teach our students in a variety of courses and on fieldwork. They mentor our students, and they advise faculty on curriculum development. Their expertise helps us exceed accreditation standards. Their commitment to excellence and dedication to teaching our students while juggling the demands of both clinical and academic work warrants our highest praise. Thank you so much to each of the 2020 Teaching Service Award recipients. You have been outstanding role models for our students and incredible supports and sources of creativity and inspiration to our faculty. I'm now very happy to introduce Lindsay McCrae, who will present the Excalibur Teaching Award.
It's with great honor that I get to present the Excalibur Award for Teaching Excellence. This award is reserved for faculty who are role models in their profession, who provide encouragement for learning in the classroom or clinical setting, who help guide students in the achievement of their goals, and who are supportive of students' individual efforts. With careful thought, the class of 2020 selected one faculty member who absolutely shines in these areas, greatly contributing to our learnings as future OTs. The winner of the Excalibur Award for Teaching Excellence for 2020 goes to Dr. Ashley Stoffel. Congratulations, Ashley. I asked my classmates to share their thoughts on the impact that Ashley has had on their time here at UIC, and it became immediately evident that Ashley's impact is felt far and wide. My classmates shared that Ashley's courses are always engaging, thought-provoking, challenging, and fun. She's consistently prepared and organized, showing up to class with a positive attitude and an impressive agenda for the day. Ashley works tirelessly to provide us with access to relevant case studies, clinical examples, and opportunities for hands-on learning. She creates a safe space for learning to occur and exudes an unwavering commitment to her students' success. It was noted by one of my classmates that Ashley sets the bar high for her students, but is always there to support them along the way. In many ways, Ashley teaches by modeling the ideal traits of any occupational therapist: to meet students where they are, to demonstrate compassion and support free of judgment, and to provide creative and meaningful learning opportunities. We will be forever grateful for the opportunity to learn from such a dedicated, enthusiastic educator and exemplary OT who goes above and beyond for her students. Congratulations, Ashley, and thank you for all that you do. This is well-deserved.
Thank you, Lindsay, and congratulations to our Excalibur Award recipient. Each year, the department invites a person who is special to the class to present the keynote address. This person is decided upon by the graduating MS students. It is my pleasure today to introduce our 2020 keynote speaker, Dr. Maureen Gecht-Silver. For our audience members who do not know Maureen, let me tell you a little bit about her. Maureen Gecht-Silver is the Associate Director of Medical Student Education in the UIC Department of Family Medicine. She is also an occupational therapist in the UIC faculty practice. Her clinical interest is in chronic condition management. Maureen has been an important contributor to MS and PostProfessional OTD programs. She has lectured on topics related to promoting client self-management and motivational interviewing, and she has also supported OTD projects related to self-management. Maureen is a trainer for Stanford University's Chronic Disease Self-Management Program, which many of us know as CDSMP. She has also co-authored several CDSMP course textbooks. Maureen has participated in several research studies related to self-management group interventions. She's also from Milwaukee, Wisconsin, and is an avid walker, meditator, and gardener. Maureen, we are so glad that you're with us today. It is my pleasure to now introduce Dr. Maureen Gecht-Silver.
Welcome, MS Class of 2020, OTD Class of 2020, family and friends, faculty and staff. It is an honor and a pleasure to give this keynote to the class of 2020. When I was contacted to speak at the virtual December pinning, I wondered, what would I say to all of you? You have been through a challenging time. I started by reading the speech I drafted last February about lifelong learning, and I threw it out because times have changed since then. Then I realized the topic was right in front of me. the silver lining of COVID-19, the potential benefits you reaped from finishing your training during a world pandemic. As our UIC Chancellor, Dr. Michael Amaritis, stated in a recent email, we know that 2020 has been a year of great uncertainty. It may have raised worries about your future. You may have been sad to give up a coveted field placement. It may have made you angry. You may have felt driven to eat too much chocolate. Maybe you felt overwhelmed, finishing a culminating project at home instead of completing your 2 weeks of on-site field work. Whatever challenges you experienced, you found a way to adapt, to progress, and to finish your OT training. Even if it was bumpy, you made it. What could possibly be positive about experiencing uncertainty and still progressing with your life? Let us take a moment and think about your future clients and their families. A parent whose 3-year-old was recently diagnosed with cerebral palsy. A 30-year-old violinist unable to play in the orchestra due to persistent hand pain. A 70-year-old just transferred to the rehab floor post-stroke. What these clients and their families have in common is they all face profound uncertainty. They face worries about their future, worries about occupation and livelihood, and worries about the ability to participate in their daily activities. They do not know how things will work out. They may have lost hope that things could work out. I suspect many of you will be better equipped to notice and listen and guide after your own brush with navigating through profound uncertainty. It was a jolt when the world shut down in March 2020. Now take a moment to think about what you did or what you changed to do the best you could during the pandemic. How did you self-manage your health and well-being? For graduates, maybe it included connecting creatively with classmates. For all of us, it may be deciding what is most important, getting outside more often, gardening, cooking, appreciation of nature, being kind or caring more for others. Maybe you took the time to notice flowers bloom or felt more grateful for what you did have. In my household, we made many changes. I will highlight a few. My husband became the grocery shopper for his elderly parents and for our family, assuming a caregiver role that added meaning and structure to his week. With coaching, his grocery shopping skills dramatically improved, enough to receive high praise from me, and believe me, I have high standards. My college-age son, taking courses in our basement, created a habit of late-night calls, FaceTime, and Netflix parties to maintain his social connections. And with the YMCA closed, I started walking outside in rain or shine. I often walked with my husband or son. We met neighbors and dogs and children that added missing social connection. I felt more at home than ever in my neighborhood of 20 years. The limitations of the pandemic did not stop me, and it did not stop you. You made habit and role changes to self-manage, to stay resilient. Perhaps you made goals and action plans like your life and health depended on it. The adaptations you made relate to our field of occupational therapy. We help people look at what they can do. We explore with people ways to make life meaningful, even at a time when things seem bleak. It is common to feel strong emotions such as anxiety or sadness in difficult times. In the words of psychologist Kristen Neff, co-founder of the Center for Mindful Self-Compassion, by giving ourselves unconditional kindness and comfort while embracing the human experience, difficult as it is. We avoid destructive patterns of fear, negativity, and isolation. So let me ask each of you, on a scale of 0 to 10, with 0 being not kind and 10 being very kind, how would you rate your kindness to yourself? Whatever number you chose tells you where you are today. Sometimes when things are hard, it is easy to be self-critical. Being kind to yourself in difficult times does not just apply to a pandemic, but a lifetime ahead. Perhaps you were too busy surviving to pay attention. Perhaps you caught a glimpse of being kind to yourself. Perhaps you found some other ways to manage challenging emotions that worked for you. Gaining some degree of emotional calm on the inside can make it easier to surf the waves of life. You have jumped a hurdle and deserve to celebrate today. Completing your training during a world pandemic is no small feat. Hurdles such as securing a job lie ahead for many of you. Ironically, the silver lining of COVID provided many opportunities to develop yourself, to prepare for future challenges that life brings. Smaller challenges, I hope. However well you fared, you have a lifetime to develop further. Challenges and difficulties come with life. Yvonne Pierre, who has experienced many life challenges, said, "Use what you've been through as fuel, believe in yourself, and be unstoppable." Class of 2020, I am grateful for the opportunities I have had to work with you. You inspired me. I feel deeply touched to be chosen by you to give this address. I applaud you, class of 2020. You have a special skill set to take into the world. Your clients will be especially lucky to work with you. Thank you.
Thank you, Maureen, and thank you for the many contributions you have made to the occupational therapy program at UIC. In recognition of your important role in our ceremony today, the department is presenting you with this award. Thanks again, Maureen. At this time, I am pleased to introduce Lindsay McCary and Amanda Pineda, who are presenting the student response on behalf of the class of 2020.
It goes without saying that this celebration wasn't intended to look like this. It should have included a room full of excited energy, lots of hugs, laughs, and hopefully some delicious snacks. And it's all very disappointing that such a celebration is not possible for us at this time. But we wanted to take some time today to take a step back from that feeling of disappointment and remember why this celebration matters so much to us. It matters because we worked so hard to get here. It matters because we allowed ourselves to be challenged and to be pushed out of our comfort zone. It matters because there were many sacrifices made along the way. And it matters because we set out on this journey with a clear goal in mind, and we've made it to the glorious finish line. Whether in a crowded room or an intimate setting with someone you love nearby, all of these accomplishments ring true. So with that, please let yourselves enjoy today, basking in all you've accomplished and all you've overcome to get here. Now, let's take a stroll down memory lane. Our program started well over 2 years ago in room 313, a room that we will always fondly remember for its temperature extremes. We were a bunch of strangers then, full of excitement and nervous energy, eager to get started on the journey to becoming OTs. I think it's safe to say, however, that none of us could have fully anticipated what the MSOT journey would hold. Our curriculum covered a vast array of content, from pediatrics to neurologic conditions to mental health and beyond. We learned how to fabricate splints, evaluate range of motion, teach techniques for donning pants after a stroke, support individuals in safe transfers, and administer assessments. But perhaps most importantly, we gained clinical reasoning skills and a new lens with which we can view this world. As a rite of passage into OT, we all became intimately familiar with the phrase, "it depends." As students eager for the right answer, many of us struggled to accept the seemingly gray area. Now, with 2 years of wisdom behind us, we know that this so-called gray area is where our clinical reasoning skills shine. We've come to understand how each individual's story is unique and is influenced by their physical and social context. We learned the importance of habits, roles, and routines, and the influence of volition on patient outcomes. And with our clinical reasoning skills, we learned to take all this information and use it to change people's lives for the better. We've really come a long way in the relatively short period of time. I encourage you all to think back on the weeks leading up to our first full standardized patient experiences. I apologize if your heart just skipped a beat. We spent weeks writing and revising treatment plans while stressing at the inevitability of unexpected events. We questioned if we had the skills or knowledge to have this patient in our hands. I can so distinctly remember that shaky, nervous feeling before knocking on the patient's door. Now, with fieldwork and 2 years of continuous effort behind us, we're able to apply these skills on a daily basis. Still, our learning is far from complete as we begin our OT careers. We might continue to feel nerves upon walking into an evaluation, stumble when faced with a complex case, or question our knowledge of a specific and unfamiliar condition. During these times, we encourage you to remain humble and open to learning, while remembering all that you do know, trusting the skillful clinical reasoning which you've worked so hard to build.
We reached out to our cohort to share their reflections on these past couple years. An overwhelmingly common theme emerged: the people. Our cohort spoke to the valuable friendships created and the supportive and collaborative environment fostered among students, faculty, and staff. There were many experiences that challenged us, such as EBP, standardized patients, presenting at conferences, and OTIPM. Luckily, we had each other as guinea pigs for patients. We shared resources and group study guides. We had hallway hugs during breaks, and we had late night calls for shared tears and pep talks. We also made plenty of time for fun. We had potlucks, group outings, Zoom calls, and Halloween celebrations, where we all got to laugh at Kitty's infamous turtle costume and Celeste and Jenica dressed as each other. Every experience, both challenging and fun, shaped our collective journey through graduate school. Each student had their own unique journey that required hard work and sacrifice. Some worked jobs, some raised children, some moved far away from family into a new city, and we all sacrificed time with loved ones. As we pushed our way through the program, we all faced hurdles we needed to overcome. We had moments of exhaustion, doubt, fear, and panic that made us question if we'd ever reach the finish line. In those moments, we were surrounded by love, support, and encouragement that lifted us up and allowed us to move forward toward our goals. This love and encouragement came from both within our program and from friends and family at home. The people that embraced us and lifted us up during our toughest times allowed us to stand here today. Thank you to our amazing staff, committed faculty, and loving family and friends for supporting our journey. And to our cohort, you have graduated from a challenging program during an incredibly trying time. You have gained an enormous set of tools, and in the coming months, if not already, you will go on to use those tools to change lives. Whether in a clinical setting or in our communities, many of you have already proven this to be true. In the past several months, you have identified problems and sought solutions, called out injustices, and fought for your communities. You have proven that there is light even in the darkest of times, and knowing that the lives of so many will be touched by this group brings us immense comfort. As our program officially comes to an end, we'd like to share advice from the cohort to take with us as we begin our careers as OTs. Use your voice for change. Push boundaries and remember your why. You are resilient, disciplined, motivated, talented, flexible, and fabulous. You came here with a purpose and you are ready to share that purpose with the world. Class of 2020, with much love and admiration, we congratulate you on this great accomplishment.
Thank you for your heartfelt student response, Lindsay and Amanda. As we transition to the main event of the day, let me tell you a little bit about our pinning ceremony. The UIC Department of Occupational Therapy was created in 1943, and the first department head, Beatrice Wade, began the proud tradition of a pinning ceremony. Pinning ceremonies celebrate transition, that of student to professional. The students honored today have completed their master's degrees and have completed or are preparing for the final steps of entry into the profession of occupational therapy. The term profession has special significance. It's different from a job or even a career. Members of professions share several key responsibilities. Among others, these responsibilities include developing and evaluating your own body of knowledge or science, and providing oversight to one's own practice and that of their peers to assure that members of the profession are meeting the highest ethical standards. Meeting these expectations as a profession requires critical thinking, integrity, commitment, and perseverance. You have already demonstrated your ability to do this, class of 2020. Although no one could have imagined the impact that the pandemic would have had on your education, as Maureen said, you have found the silver lining in your situation, and you grew as individuals in ways that would not have occurred otherwise. Your ability to excel during fieldwork at a time when you were unmoored and facing so much uncertainty speaks to your ability to manage future challenge that life brings your way. Today, we welcome you as colleagues to the profession. It is my pleasure to present the 2020 graduates of UIC's Masters of Science in Occupational Therapy program. Congratulations, class of 2020. It is my honor to now introduce Amanda Pineda, who will recite the Occupational Therapist's Creed.
Respectfully and enthusiastically, I do hereby promise my wholehearted service to care for those entrusted to me. I assure competence in my work and will strive for greater knowledge, skill, and understanding in the discharge of my duties in whatever role I embrace, practitioner, educator, researcher, or manager. I solemnly declare that I will hold and keep sacred whatever I may learn of the lives of those I enter. In embracing the responsibilities and challenges of working with persons of diverse backgrounds, I will uphold a person's right to self-determination and will always endeavor to provide quality care. I pledge from this day forth to forever serve ethically and compassionately, and I hope for patience, gentleness, and understanding in all therapeutic partnerships.
This year, I'm excited to also announce the graduates of our PostProfessional OTD program for the first time at our pinning ceremony. This year's graduating class is our largest group to date, and I'm incredibly proud of our OTD graduates who completed their advanced studies and OTD projects during a very difficult time with COVID. You've been resilient in coping with unforeseen circumstances, have supported each other throughout the process, and have created and defended excellent projects that exemplify our UIC community-engaged scholarship of practice. I'm excited to follow you and your contributions to the OT field and profession as you take on leadership roles. Congratulations to all of you on a job well done. It's my pleasure to present the 2020 graduates of the UIC PostProfessional Occupational Therapy Doctorate Program.
Our ceremony will conclude in just a moment, and the department would like to invite you to a virtual reception via Zoom. A final thank you to all of you for supporting our 2020 graduates and the university, and a special thank you to Winnie Lucas of UIC Creative and Digital Services and to Maria Larson for helping us create the first ever virtual pinning celebration. To the class of 2020, please know that although our celebration is virtual, our pride in you could not be more real. Thank you.